everybody, and welcome to TalkSped. In today's segment, I'm super excited to talk to my friend who's an audiologist, Rupa Rao. She practices in Ohio. I'm going to let Rupa introduce a little bit more about herself.
Hi
Welcome, Rupa.
everyone. Hi everyone. My name is Rupa Rao. I'm an audiologist, and I did my undergrad in India at All India Institute of Speech and Hearing, and came here in '92 to do a master's in speech language pathology in Ohio University. Then came to '94. I came to Ohio State University to do a master's in audiology. And I've been working as an audiologist ever since. Needless to say, I prefer audiology to speech pathology. And I work at a place called Here USA, which is a little clinic. So that's a little bit about me.
Wonderful, Rupa. Yes, we both go back to undergraduate days. So we are very good old friends. And it's so exciting. This COVID has given an opportunity to connect with my friends and listen and hear from and share what they have been up to and how they are helping. Especially, I'm so excited because Rupa is an audiologist, and we've been doing segment about where we're talking about how assistive technology can help people with different challenges. And as an audiologist, Rupa, could you tell us, our audience, a little bit more about how you help people with preventive hearing? It is March 3rd, the Hearing Awareness Day, and we want to talk about how the role of an audiologist plays in preventing hearing loss and creating awareness on hearing care across the world.
So I think that one of the biggest aspects to preventing hearing loss in people is just creating awareness as to what causes hearing loss. And one of the most common preventable causes is noise exposure. And unfortunately, people get the wrong idea. They think like, oh, if I work like near a jet engine, that's what's going to cause a problem. But everyday activities like mowing your lawn, vacuuming your house, listening to music with your AirPods, or just listening to a podcast with your AirPods, all of those can cause hearing problems. So I think as an audiologist, our job becomes to educate people about these more common dangers that can, that they don't even consider as causing problem, but it actually really does.
Wow, yes, Rupa, you bring such a good point about all this everyday life activities. Would you tell me a little bit more about your current position of where you work and how you are, what is your role like right now?
Yeah, so I work for a company called Here USA, which is the world's largest hearing healthcare company. We own about 350 clinics in USA, and my clinic in Dublin, Ohio is one of them. It's a corporate-based company. They're an awesome company to work for. And my job as an audiologist, my day-to-day job is primarily working with geriatrics. And so we start with a full comprehensive audiological evaluation, a hearing test, and it gives us a baseline as to where they're at. And if they have a hearing problem, then the next step is to tell them how to treat it. And normally with geriatrics, if it's like an age-related, noise-related kind of hearing loss, the two most common causes of hearing loss, the treatment is hearing aids. So then we help them pick out the hearing aids and fit them with it and follow up with that.
Wonderful, Rupa. I know that is such a critical factor as we all age, but before we get into that, you alluded a little bit about all the different daily activities that can cause hearing loss. And I know our worlds have changed, right? We are always in front of a screen. We are, constantly plugged in with earphones, and not just in the digital world that we live right now due to COVID, but also our youngsters are always with AirPods in their ear and their ears plugged in when you're talking to them. I have my son who literally takes one off when he's talking to me, and I know that this is a time I can have a conversation. Otherwise, the ears are blocked again. So, what do you say about tell us a little bit. I'm so curious to know about how all that is affecting our hearing and what can we do to prevent it.
So one of the most common tips I give parents, teachers, anybody who deals with kids or adults for that matter, is that If you can sit next to the person who has earplugs in, whatever it is, AirPods or earbuds or headphones, if they have that in and you sit right next to them and you can hear what's going on through their headphones, then it is a noise inducing level. It's way too loud. They don't need it that loud. And loudness is also a very learned phenomenon. So if you listen to it loud, after 2 days, that's all it takes, short amount of time. You lower it a bit, your brain will tell you, oh, I don't hear it now, so I need it loud. So it's very important that you educate whoever, and yourself included, myself included, that I don't need it loud to hear it. I just need it to be audible. That's where it needs to be. So as a parent, if you go near your kid and you can hear the song they're listening to, that's already causing damage at that point.
Wow. Wow, that is some news, I think, for all of us. Let's think about it and check it out next time. Especially right now, we are in homes where, 3 or 4 people are constantly using the same screen time, and at the same time they're talking. So it is so critical. I think what you share with us is very helpful, and we as parents and adults and users of daily screen time should keep this in mind. So that is with COVID, and thank you for sharing it. Let's talk. I know that you shared that you're working with adults and geriatric population, but let's begin with when children are born, how does hearing play here? We all know, as speech therapists, you alluded to earlier, that it's so critical to have a good hearing health for speech and language skills, for developing your communication skills. So tell us a little bit more about, as a parent, how do I take care and make sure about the hearing health of children?
Well, one of the best things is we're fortunate to live in USA, because US has very good newborn infant screening laws on place, and they're adhered to very strictly. So every child who's born in the USA, no matter which of the 50 states they're born in, they will undergo infant hearing screening. Now, which screening it is, whether it's an electrophysiologic screening or a paper screening, that depends on the state. But they will be monitored for hearing loss. So, and that's an awesome development. It's just happened in the last 10 years, maybe. And so we can identify hearing loss at birth. And the kids who fail the screening, it's not necessary they have a hearing loss, because sometimes in the process of normal childbirth, they will have debris in their ear canal, and that will make them flunk the screening. But then when you screen them 2 weeks down the road, their hearing is perfectly normal. So just screening them at birth, and then if they fail it, they screen them again 2 weeks to a month post-delivery. And if they fail that, then the chances are that your child indeed was born with a hearing problem. And the doctors and audiologists are great at following up and suggesting what can be done about it. And in the US, most of the time, the child has either been fit with a cochlear implant or with a hearing aid well before they're 6 months old by that time. So it's
wonderful. Yeah, we don't want to lose. We all know about early intervention, right, and how critical that is for as much as possible to help children develop age appropriate speech and language skills. So as early as before 6 months of age, they are fitted with their the best way that they can absorb and hear the environment and develop those language abilities. And tell us a little bit more about, if I'm a parent, like how diligently, what is my role to help my child follow through with this hearing care?
That's a great question, because the parent's role is probably the most important role, because they have to be a partner in this whole journey, and it truly is a journey. It doesn't end with implanting, or doesn't end with fitting with a hearing aid. So in the beginning, when your child gets either implanted or gets fit with a hearing aid, the parent will have to bring the child in very frequently for follow-ups. And in pediatric cases, there will be frequent follow-ups required, just for the simple fact that the child's ear keeps growing. So the device has to fit properly into that ear. But in the beginning 6 months, there will be it could be like weekly, bi-weekly, bi-monthly follow-ups. And then it kind of peters off as the child grows a little bit and as the parent gets more comfortable.
Right. Yeah,
So
no, I hear from you, and I know even with school districts, it's so important that we work together as a team. We support the parent, we support the speech therapist, and the audiologist, and the entire team of the educators that understand what it takes for their child to function in the school environment. And because it's so critical, again, like I
right.
was sharing with you about the case that I had recently, where the parent is still struggling for their child to wear his hearing aid, and he's a growing teenager. So again, somehow there are so much barriers that we were talking about, and that is a big barrier, and he doesn't think it's cool enough, he doesn't want to do it, and now it's affecting his academic. And so tell us a little bit more about that piece of it, Rupa. What is your advice, or what have you seen in your practice?
So my practice doesn't primarily, it's primarily with geriatrics. So, but having said that, adults and older people are not, they also have a stigma about hearing aids. They also want the hearing aids to be really invisible and not be seen, and for nobody to know they have a hearing problem. But luckily for adults, there are way many more options because their ear isn't growing at that point. So
Right,
we fit them with almost like what we consider invisible hearing aids, because they go all the way inside the ear canal and nobody can see it. There's even something like a lyric, which can be which the audiologist places in the ear, and then they don't take it out for 6 months, and then or 3 months.
wow.
So yeah, there's like for adults, there's a lot more solutions. For children, it's still a little fewer solutions because the ear keeps growing, and hearing aids are so expensive that nobody can afford to replace it every 6 months to a year. Most parents want it to last the whole 5 to 6 year time frame. So then you're kind of stuck with behind the ear hearing aids, and that's what these preteens and teens are not very happy about because they're a
Yes.
little bit more obvious. But once the child has kind of completed their growth, then you can get them the real tiny ones too. And they're way more comfortable using that, at least till they get over the hump.
Yeah, no, I agree with you. I think there's a stigma around it. People are comfortable wearing glasses, at least now. And we were just talking about it, that how hearing aid still has a way to get there in the fashion statement for people. So I think whatever we can do, however we can help our family members to understand the importance of it. But can you share a little bit more about the role of audiologists in preventing hearing loss and overall health, how it affects?
So, preventing hearing loss, the role of an audiologist will primarily be education, education, and more education. I always try to tell patients that, don't think of jet noises as the only thing that causes hearing loss. Your everyday activities can do it. So, education is the primary role, and also to tell them that when you vacuum your house, wear earplugs. You can buy these earplugs. They're super cheap at any drugstore or grocery store. Just pop them on when you do something as simple as vacuuming, something as simple as mowing the lawn. So that's in terms of like preventing of hearing loss, because that's about the only thing you can do other than staying away from noise. But in what was your other question?
I wanted to know, like, overall health. What are some things that you want to highlight about hearing loss to our audience? How does hearing relate with the overall health?
So I think the biggest thing that I want to highlight, because this is often overlooked or not really understood much, is the fact that there's a very strong correlation between untreated hearing loss and dementia. And I'm primarily talking about adults, of course. So you'll be surprised that research shows that the average time frame from when a person gets diagnosed with hearing loss to when that same person decides to start using hearing aids is about 7 to 9 years. Can you imagine?
Wow,
7 to 9 years. So
that is a long time.
it is. So you've had a long time for your ears to kind of deteriorate because you're not stimulating them by using a hearing aid. And there is a strong correlation that the longer that time frame goes, there is a higher probability of you developing dementia or Alzheimer's. So I always try to tell my patients, because they often come accompanied with their adult kids. And I always try to tell them, if you notice that your mom or dad has hearing issues, or the mom and dad themselves notice it, then you need to get on their case and you got to do something about it, and do it now rather than doing it 2 years down the road, 4 years down the road.
Right, right.
Um, so that would be my number one. The second one, I think, is also that there's a very strong correlation between diabetes and hearing loss.
Oh,
So research,
wow.
yeah, so research shows that people who are diabetic, the longer they've been there, they've been diabetic, the more the chances that they have hearing loss. And diabetes is almost like an epidemic. Almost every other patient of mine seems to
Right.
have it. So I always tell patients that once they get diagnosed with diabetes, you want to start getting regular hearing tests done, just to monitor your hearing status.
Sure. Thank you so much, Rupa. This has been fascinating. I think our audience learned a lot about preventive health and how overall health can get affected if we're not taking care of our hearing, hearing status. So, you have shared some very good insights and information with our audience today. And hopefully, on this World Health Day, and moving forward, we all have a little bit of more knowledge about our hearing care and hearing health. Thank you again for your time, and thanks for being with us.
Oh gosh, no, my pleasure. Thank you so much for having me.